What standardized screening tool is used to monitor severity and response to depression treatment? The PHQ-9 Patient Health Questionnaire 9. Scores greater than or equal to 10 generally indicate moderate to severe depression. What is the standard minimum duration for continuing an antidepressant after a patient achieves full remission from a first episode? 6 to 12 months at the same therapeutic dose that achieved remission to prevent immediate relapse. What is the preferred first-line pharmacological agent class for generalized anxiety disorder, GAD? SSRIs, e.g. escitalopram, or SNRIs, e.g. duloxetine. Benzodiazepines should be avoided for long-term management. Why must you screen all depressed patients for a history of mania before starting an SSRI? SSRI monotherapy can precipitate a manic episode or induce rapid cycling in patients with underlying bipolar disorder. What single screening question is highly sensitive for identifying unhealthy alcohol use in primary care? How many times in the past year have you had 5 for men/4 for women or more drinks in a day? What first-line medication reduces alcohol cravings and blocks opioid receptors, but requires monitoring liver function? Naltrexone. Ensure the patient is completely opioid-free for at least 7 to 10 days before starting. What is the preferred first-line medication for opioid use disorder that can be safely prescribed from a standard clinic? Buprenorphine, often combined with naloxone, which acts as a partial opioid agonist to suppress cravings. What baseline assessment must be completed before initiating a stimulant medication for an adult with ADHD? A thorough cardiovascular history and physical exam, including blood pressure and heart rate monitoring. What is the primary management strategy for a patient diagnosed with somatic symptom disorder? Schedule regular, briefly spaced appointments to validate symptoms without ordering unnecessary diagnostic tests.